Soft tissue graft failure. I love reviewing failures. I know it's painful to see them because when they fail, and it's not fun to see and experience and discuss with the patient. Patient has a history of orthognathic surgery. He's a non-smoker. He's a physician. And photos of pre-op and intra-op 6 weeks. Is this case a failure? Patient concerned why not enough root coverage was gained, no other complications observed notice. Is it a surgical technique, patient's biology, or other dental related issues? Will regrafting be recommended? So let's look at the case. I think we're seeing a periodontal patients with calculus, so I think, that needs to be maintained. Orthognathic patients, guys, orthognathic patients have gone through a very traumatic procedure. They've gone through chin advancement. They've went through sagittal split, bilaterally, moving the mandible anterior and forward. If we're dealing with the maxilla, they're dealt with Lefort osteotomies. They had incisions in the vestibule with scarring, and they have screws. We have a few issues with orthognathic patients. Vascularity is a problem, and scarring. Tissue is scarred and doesn't stretch as much, and you see that this patient's bite is also not very conducive to great occlusion. Okay, number one. So here's the donor site healing. There was a connective tissue attempt. It looks like it was done okay. Looks like the tissue was advanced. However, as the patient healed, we got the recession back, and we lost some of the attached tissue. Here's the graft that was harvested. So I feel like the graft was harvested in a beautiful way. Don't worry if it has some notches in it. It's not a perfect rectangular shape, but it's very nice, very nice. I feel like that's great length and great thickness and great shape and great preparation. You may have over sutured it or may not relieved it enough. Looks like you did a tunneling approach. The problem here is that a real failure? Well, from a patient's perspective, it's a failure because you didn't get the coverage, but I don't see that as an issue. The issue that I see is more you lost the attached tissue. That's the thing. If before, take a look at the tissue here. Take a look at this tissue here. And now take a look at the tissue pre-op. You still had keratinized tissue. Now you don't have it anymore. So from that sense, I feel like we got a little bit worse. We got the recession to relapse, and we got the attached tissue to disappear just because of the surgical trauma. Don't feel bad. It happens to all of us, including myself and Rashad. What to do next? Great question. First of all, communication with the patient. Explaining. We didn't get what we wanted to get. We didn't get the root coverage that we're expecting because even with orthognathic surgery, probably orthodontics, your bite is still off. These teeth are outside the bony envelope. There's probably not a whole lot of bone around them. So I feel like the performance was okay, maybe a little bit over sutured, but I think you were able to advance. Orthognathic cases is very commonly a problem with blood supply and scarring of the tissue. Scars are not vascular, but also resist the pull. And I feel like it's okay to consider free gingival graft to improve tissue quality. I love your harvest. Your harvest was excellent. Will the patient accept a free gingival graft now? I'm not sure they will. But it's worth trying. I would probably do a free gingival graft from the lateral to here. That would be my preparation, and then I would take a graft and suture it mostly on the recipient bed and put it about 50% of the root and try to get some of it to be covered. But don't forget to extend it to the vascular site. I hope that helps. The hard part here is the communication, how to communicate with a doctor that has, with a patient that thinks didn't get what they want. Explain the orthognathic angle I reviewed with you today. Wait 6 months before assessing for a new graft. Maybe we'll decide, let's look at it in 6 months. Maybe we'll decide to have another grafting done with connective tissue. Since you did such a great job in the harvest.